start in 2 minutes time. Just to say that we're giving 2 minutes for people to log on and situate themselves. Thank you. Good morning, everyone. Thank you so much for joining this webinar this morning. We're so excited to have all of you join us today. We had, I think, 260 people register to take part in this webinar, so there's great interest in the subject matter. We're so happy to have you join us here. We can see that people are still logging on, so we're very grateful. Please, feel free to carry on coming in and joining on to the session. We have 3 people who are going to be on the panel this morning, but before I introduce them, just a bit of housekeeping. We will have 1 major presentation. We will have 2 discussants. As the presentation is going or while the discussants are giving feedback, please feel free to send your comments in the chat box, which will respond during the course of the session or after the session. Again, after the presentation and after the discussions, we'll have time to have questions from the floor. So all of the great colleagues who have logged on will have an opportunity to be able to discuss with our panelists this morning. And for others who are in the afternoon, we can see people coming in from all over the world, Antananarivo. Yesterday, I had confirmation from people coming in from Bangladesh. We're so happy to see that this is also of interest to you. We know definitely the African contingent is in-house, so thank you so much to all of you who are affected by both of these issues. This webinar this morning for us within New York, is still morning, is on understanding the relationship between child marriage and FGM. I'm so happy to have my colleague, Claudia Kappa, who's a senior advisor on statistics and monitoring in UNICEF. We've been discussing this issue for quite a while amongst ourselves and debating, is it going to happen, is it not going to happen? Claudia, for me, has the answers to all of the issues that we're working on. So I've been looking forward to having this webinar and being able to hear from her. I know a number of people are working in this area. A few weeks ago, we have Yvette Kathmira, who's the head of Africa Engagement at Girls Not Brides. We know Girls Not Brides had their own session also looking at FGM and child marriage. We're very happy to have Flavia, who is the global lead on End Harmful Practices at Equality Now. And Flavia's portfolio includes FGM and child marriage, as does my own. So that's just a show of how much interest there is in these 2 particular issues. It's something that we need to be able to think through. And certainly within the context of the SDG 5.3, we know, again, both child marriage and FGM sit within the same SDG, and it's something that we're all working towards to achieve elimination by 2030. This was our big year, 2020, for us to work towards our last 10 years to achieve that elimination goal. We got hit by COVID, but I'm so happy to see that we're all still going strong. We're still standing here. Claudia is still doing the analysis for us. so that we know, where are we, where do we stand, what are the issues, what are the challenges, and how can we be more data driven in terms of our programmatic approaches. So first of all, over to Claudia to do the presentation on this analysis. Just to say, colleagues, that this analysis at this point, cannot be quoted. It is yet to be launched, and we will come out through our social media platforms and share with you when it's ready to be quoted. At this point, it's analysis that she has done that we can discuss, and during the course of this presentation, we will also be sharing a recording. But it's unpublished at this point, so please do take it within that spirit. Thank you so much, and over to you, Claudia.
Thank you very much, Nankali. Good morning, good afternoon, good evening, colleagues. I'm very excited to be here and present on behalf of a team who has been working on this analysis over the last couple of months. They are also in the audience, so I wanted to very quickly acknowledge their contribution, Colleen Murray and Yoonju Parks. I also want to thank the Global Program. We are statisticians. We work with data, we work on survey designs, so we are not directly connected to the programmatic work. But I'm really grateful to the Global Program because since the inception of the both global programs, we have been constantly asked to provide statistical evidence that can support advocacy and programming. And this is shouldn't be taken for granted because, of course, for us, data people, there is nothing more frustrating than seeing that our analysis, our research is not used. Well, in the case of the Global Program, we have been pushed constantly to produce relevant analysis and new data collection so that it can be used for the purpose of orienting the programmatic work. So it's been a very fruitful collaboration, and I truly hope that you will find this type of analysis useful. I also would like, through this webinar, to get your inputs on things that we should look at, because again, we are number people, we are data people. We need support from those working on the field to orient our analysis to make sure that they are the most relevant possible to produce a change. So the piece of work I'm presenting today started with a simple question. Are FGM and child marriage affecting the same population of women? How these two practices occur? Because of course they are both a manifestation of gender inequality. There is an underlying determinant that of course link both of them. So we wanted to see, okay, let's do an overview, a global overview of the two practices. Let's try to understand where this practice coexist and the characteristics of women who are exposed to both, as opposed to women who face one practice or the other. So this was the intent of the presentation, and here are the results. First of all, let me start with a global picture. Child marriage, as we know, has affected more than 650 million girls and women across the world. These are women who are alive today and were married in their childhood. We also know from the statistical analysis that the levels of child marriage are particularly high in sub-Saharan Africa in terms of prevalence, followed by South Asia. So it's in sub-Saharan Africa where the risk of getting married in childhood is currently the highest. Now, when it comes to FGM, we have data for around 30 countries where the practice is mostly concentrated. In these 30 plus countries, at least 200 million girls and women have undergone this practice. Now, we know, of course, that the practice also exists in other countries, including in pockets of population in Europe, for instance, in North America. So we do not know the exact number worldwide, but this figure that I mentioned cover most of the women who have been affected by the practice. We also know from the analysis and the research that has been conducted on one practice or the other, that we have certain girls who are particularly at risk of undergoing child marriage and undergoing FGM. And these are normally tend to be girls from rural areas, from poorer households, and with less education. They are most at risk of undergoing child marriage and FGM. But let's now zoom into how these two practices more closely relate to each other. And what we did is simply to look at the country of highest prevalence for child marriage and FGM. And you can see, you will see many graphs today, so I apologize in advance. I'll try to convey the main messages. So if you can see the graph to the left, these are the top 10 countries for child marriage. And this is what you can see in purple. This is the prevalence of child marriage in the top 10 countries in the world with the highest prevalence. And then we accompany that for the same top 10 countries with the prevalence of FGM. In the graph to the right is the opposite. So we took the top 10 countries for FGM and we listed there the prevalence of child marriage as well. And as you can see, these countries that have the highest concentration of child marriage or FGM, they are not necessarily the same. Because the country with the highest level of child marriage, for instance, is Niger, where FGM is very rare. It affects a little bit less than 2% of the population. But when it comes to child marriage, it affects close to 80% of the population. So if we now look at the context of FGM, we can see that the top 2 countries for FGM are Somalia and Djibouti. But in these 2 countries, particularly in Djibouti, the prevalence of child marriage is relatively low, is around 15%. Another striking case, of course, is Eritrea, where the prevalence of FGM is over 80%, and the prevalence of child marriage is below 20%. So if we then, of course, look across these 2 graphs, we can see that there is a level of overlap because there are certain countries that appear both in the top 10 for child marriage and the top 10 for FGM. And these are countries that you can see here, like Mali being one, Guinea being the other. So there is, of course, a high level of concentration in certain countries, but this is not, of course, the majority. And then you have contexts like Mozambique and Nepal, where we know that child marriage is an issue. It affects more than 40% of the population of women, but FGM is not found there. And Bangladesh is another example as well. Now, besides this overview, global level overview, we decided to focus our analysis on a subset of 9 countries, because we wanted for these 9 countries where both practices exist, we want to understand to which extent both practices affect the same group of women. In other words, in a country like Ethiopia, for instance, where both practices are prevalent, do they affect the same group of women, or we are talking about 2 separate groups of women that are affected by one or the other? And this is what we find out. So the 9 countries are Guinea, Sierra Leone, Mali, Burkina Faso, Ethiopia, Chad, Senegal, Kenya, and Yemen. We selected these 9 countries on the basis of a number of criteria. First of all, of course, we wanted to have representation from West Africa and Central Africa, Eastern Africa, and of course, the Middle East. We also wanted to capture countries where the overall prevalence of these practices is different. So of course, in countries where both practices are very common, you would expect that the level of overlap, of course, is bigger. Because if both practices affect more than 50% of the population in a country, you can expect automatically, just numerically, a certain level of overlap, right? But then we also wanted to look at countries where the practices are at different level to see if, even if there are different levels, what is the group of women who are affected by both harmful traditional practices. And in this graph, you see the prevalence of child marriage and a prevalence of FGM. And you can also see that across most countries, FGM tends to be more common than child marriage. And this is the case for Guinea, Sierra Leone, Mali, Burkina Faso, and Ethiopia. And you can also see that in the rest of countries, the prevalence of child marriage is higher than the prevalence of FGM. And this is the case of Chad, for instance, or the case of Yemen. Now, this graph is a little bit intense, but these are Venn diagrams that really show within each one of these countries what is the proportion of overlap. What is the proportion of women who have experienced FGM and child marriage. And the women who have experienced both are, the size of the women who have experienced both is indicated here in this light blue, in this dense blue. So we can see that then across all countries, this overlap, this area that is in blue, is not the biggest. And what it means is, in all the countries of the 9 that we analyzed, the majority of women experience one practice or the other, and it's only a subset of women who experience both. Even in countries of very high prevalence, like Guinea, you can see that the dark blue is smaller than the light blue. The light blue refers to those who experience FGM only, while the dark blue are those who experience FGM and child marriage. And you can see that across all countries, and that's a very important point that I want to make, across all countries, most women experience either FGM only or child marriage only. They do not necessarily experience both child marriage and FGM. Of course, you have countries like Kenya, Senegal, and Yemen, where most women are not necessarily impacted, because you have this gray area, which is the biggest. And the gray area are those who experience neither of these practices. Yeah, so the level of overlap, again, varies tremendously, but is still not affecting the majority of women. One thing that we wanted to do is to look at trends. We wanted to see if this level of overlap has declined or has increased over time. Because of course, for us, when we think about women who experience both FGM and child marriage, we are thinking about women who are the most vulnerable in a way, right? Because they've been subjected to 2 harmful traditional practices. So what we wanted to do is we wanted to see whether this proportion of women who are affected by both has changed over time. Has it declined, or it has been the same over time? And what we find is a little bit different country by country in a way. In some countries, like for instance, Burkina and Ethiopia, the share of women who have experienced both practices has declined over time. So if we look at this graph shows the prevalence of overlap, the prevalence of child marriage, the prevalence of FGM across women of different ages. And when we look at the prevalence across age cohort, we have a sense of the overlap of the historical trends in the practices. And I wanted to, for instance, pause for a second on the case of Burkina Faso. The level of overlap is represented by the green line. As you can see, the green line has gone down. So this is the proportion of women who have experienced both practice. This has been going down. And that's been going down because, that's a very interesting case for me, in a country like Burkina, child marriage has remained the same. In 30 years, there has been no change in the prevalence of child marriage in Burkina Faso, but the prevalence of FGM has significantly declined. So when child marriage remain the same and FGM go down, of course, the overlap in the practice go down. But it's interesting for me to as a research question, to understand why the situation of women in Burkina Faso has changed so much with respect to FGM over 30 years, but there has been no change at all in the prevalence of child marriage. Should we assume that the 2 practices somehow go hand in hand? Should we assume that there is an underlying cause or factors that, if triggered, can determine changes in both practice or not? Well, in the case of Burkina Faso, it looks like one has declined dramatically while the other one has stagnated. And if we look at the case of Ethiopia on the other end, that's a country where you can see the overlap has declined. And this decline has been driven by a decline in both FGM and child marriage. So it's a country where both practices have declined. On the other hand, we have countries where the overlap has not changed over time because either practices have not changed over time. And this is the case of Guinea, the case of Senegal. In both countries, over a period of 30 years, there has been very limited, if no change, in the prevalence of child marriage, limited or no change in the prevalence of FGM, and therefore, the level of overlap has remained the same. Now, who are these women? Who are the women who have experienced both practice? What are their characteristics with respect to where they live, their ethnicity, their level of education, with respect to their exposure to media, for instance, or access to employment, or even decision-making power? Are they particularly vulnerable? Do they have some certain particular characteristics that we can identify through a statistical analysis? That's what the research question that we ask ourselves. And we wanted to show some examples coming from countries. This is Kenya, and these show the level of overlap according to certain characteristics of women. And we can clearly see that there are differentials, meaning that the highest proportion of women who experience both practices are found among women who live in rural areas, are the poorest, have no education, and belong to certain specific ethnic groups. I want to focus on the ethnicity element because you can see in this graph the different proportions of women who experience both FGM and child marriage according to the ethnic groups they belong to. And in the case of the Samburu and the Maasai, the Somali, you have more than 1 in 3 women who experience overlap, who experience both practice, as opposed to 0.7, 3.7, 4.5, or even less in the case of other ethnic groups like the Luo, the Luya, the Turkana, etc. So the level of overlap varies significantly across characteristics of women. And the same can be said in Mali. As I said, Mali is a country where, again, the level of overlap is much higher because both prevalence are significantly higher, particularly FGM. FGM is almost universal in Mali. Even in countries where the prevalence are higher, we still see some differentiations. And again, ethnicity is a significant variable because in certain ethnic groups, there is indeed concentration of both practices. While in other ethnic groups, this concentration doesn't occur as much. So again, for me, that's a reminder that when we think about interventions, we really have to go at the subnational level. We really need to look at the different ethnic groups because we cannot expect to see similar patterns. And of course, what we did also is to combine this variable, combine wealth, combine education to see which are really the most vulnerable girls. This graph is a little bit complex, but what is showing is the proportion of girls who experience overlap by combining their level of poverty and their level of education. And if we look at the case of Chad, for instance, women who are in the richest quintile and have the most education, only 14% of them have experienced both practices. But the women who are the poorest and have the lowest level of education, of course, the levels are much, much higher. Now, we know already that, of course, poorer women experience child marriage compared to richer women. We also know that poorer women experience FGM to a greater extent of richer women. But when it comes to this ratio, these disparities, are the disparities bigger when it comes to women who experience both practices? Do we have the same patterns? Or women who experience both practices really have larger disparities when comparing poorer women and bigger women, and richer women. And this is what we also try to understand with the statistical analysis. And I wanted to point to the case of Kenya, because in the case of Kenya, you can see that women who experience both practices, the ratio of disparity when it comes to education, for instance, it's much higher than the ratio when it comes to child marriage on FGM, which means that the disparity between uneducated and educated women, it's bigger when it comes to looking at those who experience both practices, as opposed to the ratio that exists between uneducated women and educated women that experience child marriage or FGM. So again, really this analysis show that when it comes to the most vulnerable girls, we know that these most vulnerable girls experience overlap to a much, much greater extent. The last piece of, the last slide and the last piece of results, what we did, and of course the paper is much more complex, it's longer, we look at other elements as well. As I mentioned earlier, we look at employment, we look at decision-making power, we look at attitudes. But I wanted to conclude with the last piece of analysis. We ran a multinomial logistic regression because we wanted to understand, okay, let's take women who experience only child marriage, and let's compare these women to those who experience both child marriage and FGM. What is the most significant factor that explain why certain women experience both FGM and child marriage compared to women who experience only child marriage? And we found that the most significant factor that contribute to determining why a woman who experienced child marriage also experienced FGM was ethnicity. So really identity was the trigger that explained why certain women experience FGM and child marriage when comparing these women to those who experience only child marriage. And we did the opposite, of course. We wanted to understand what is the key factors that explain why certain women experience child marriage in addition to experiencing FGM. And in this case, the most significant factor was lack of education. So if lack of education made women from certain ethnic groups also, for instance, being married in childhood. So I'm gonna stop here. I know that this was very dense, so I will be really happy to address any clarification you have, and I look forward to hearing your reaction. Thank you very much.
Thank you very much, Claudia, for an excellent presentation as usual. Lots of food for thought for us and the sector beyond us. I'm taking away so many things. From a programmatic point of view, we have countries like Ethiopia and Burkina who are having national strategies that include both FGM and child marriage. Within UNICEF, we're structured as a harmful practices team that includes both child marriage and FGM, and we see a similar pattern, with equality now, and with Flavia also carrying both portfolios. So it's really very interesting to us in terms of how we program around these two issues. I'm taking so many things away from your presentation. I couldn't even begin to summarize, what it is that you've said. But I think for me, coming from the global program, one of the key issues is the importance of contextualization. I think we make a lot of generalizations about, both child marriage and FGM, even when we work within child marriage or FGM. And I see such differences in what you've raised across the different countries. I saw a number of questions of, specifically, I see that there's a number of people who've joined from Somalia who are asking why wasn't Somalia included? So Claudia will come back and say, why didn't you include Somalia at a later stage? But for now, let me invite Flavia for reaction. Flavia, Claudia has shared quite a bit, and it's the first time that you've seen that presentation. There's only, so much that you can take in, but, we'd love to hear from you. What are your thoughts, your reactions to some of what she said? How do you think it'll affect your work? If it's too much, you can also say that. but just some initial thoughts, at least from you.
Yeah. Thank you very much, Claudia. That was very enlightening, definitely a very valuable piece of work. We are looking forward to seeing the full report. But I think just based on what you have shared, there's so many things going through my mind currently that I'm trying to just organize my thoughts, and it's not very easy, but I'll just try and have a go at it. At first is to really acknowledge what Nankali has also reiterated around the importance of contextualizing and having subnational data, which you also alluded to, because I think it's really important that we have a very nuanced and analysis to the information that is in front of us. So for me, I'm speaking more as an activist, an advocate, and a feminist. And I really think even as we contextualize, I think we also cannot run away from the root cause of the issues, which is basically gender inequality, power, hierarchy, sexism, misogyny, etc. The value that we place on girls and women, the whole issue around commoditization of girls and women, I think that for me is the tying in factor. So even as activists and advocates, we're trying to figure out how do we respond to this, either together or separately. I think there's an opportunity to respond to them together if we look at them at the root cause as a very beginning point. And I think another point that comes to my mind, it really is around these are two pieces. One is around sexual and reproductive health and rights. In the context where FGM and child marriage are either, maybe FGM is seen as a prerequisite or something that comes before child marriage or etc. I think there's a continuous thread there around teenage pregnancies specifically, because if you're going to cut a girl as a rite of passage, as a passage into adulthood, already we are planting a seed in her mind that she's an adult, she's able to make her own decisions, she starts exploring her sexuality, that's the age of sexual debut, etc. And in some cases that leads to teenage pregnancy. And when you have teenage pregnancy happening, and in a context where adolescent sexuality is really also a taboo, where you can only have sex in the context of marriage, also that somehow drives us into a situation where we find ourselves in a context of child marriage. And if you're going to have girls getting married, also from an SRHR perspective, it means we also need to see what are the consequences of child marriage to a girl who has not yet really come of age physically in terms of pregnancies, etc. So I think the piece around SRHR is really a critical one, especially for us as advocates, if you're going to look at these practices, these harmful practices together. I think that's the additional piece that we have to see how together as actors in the space we can work together and ensure that we don't drop that piece. The other piece is around marriageability, FGM and marriageability, not child marriage per se, but marriageability. The fact that you've been cut and hence you're marriageable now, or you cannot be married because you've not been cut. So it's to just say that as much as we are trying to link the two, FGM and child marriage, I think there's something to be said around sometimes that vulnerability or the threat or the risk of child marriage does not stop simply because one has maybe crossed from 18 and is now 19 years. The fact that you will be asked, or it shall be required of you to be cut at a certain time of your life, be it at 19 years, etc., is something that we need to look at. How can we as actors and advocates delink FGM from the whole idea of are you marriageable or not, so that at that in that same breath we are also able to capture the issue of child marriage at that point. Because if I'm going to be 19 years or 20 and then at that point I have finished school, my parents have strived and have finished school, and I'm now 20 years, and then at the same time that whole context, the whole discussion around but was she cut comes in, and it means that we have to really explore this whole discussion around marriageability and see what it does. And maybe what we need to do more is promote more around girls' agency and autonomy, and really take a gendered approach to this conversation. Then the other point that I'd like to bring about is around the trends that we are seeing with FGM currently. Girls are getting cut younger, even before 10 years, because if in the context when the two happen together, if it's seen as a rite of passage, but due to various factors, including maybe criminalization or introduction of laws, etc., you're seeing families cutting their children younger. What does that say for child marriage? Because it may not be like a sequential thing that is happening, that you get a cut and then you get married, but it happens so much earlier in your life. So what are some of these trends that are happening, especially in the context of FGM, doing to how we handle or advocate for the ending of child marriage? So that's another thought. And I also think it's important to also maybe have a discussion around the right to education and how all the advocacy that we have done as actors to ensure that girls remain in school, that there's retention of girls in school, etc., and how families are navigating that vis-a-vis child marriage and FGM. Because in some contexts, especially for us who interact a lot with actors who are at the community level, we're seeing that families actually sometimes do end up cutting the girls, marrying them off, but at the same time retaining them in school. So it's like an appreciation of the value of education, but at the same time, really stuck on our ways in terms of this girl still has to be cut. In fact, colleagues were just sharing a story of how in one context, the girl goes to school, but in the evening, the person who comes to pick her from school is actually her husband because she's already been married off. So in that case, she's been cut, she's been married off, but at the same time, the whole advocacy around keeping girls in school, education, etc., has picked up. Or in some cases, where you find that since we are pushing so much an messaging or an agenda around let's keep girls in school, they are remaining in school, but the moment they turn 19 or they finish school, the girl gets married. So it's not child marriage per se. She's not 18, she's now 19, she's now 20, or she's 21. But at the same time, the vulnerability around getting married early within a context that is somehow coerced has not gone away. So those are some of the questions that we are saying we also need to interrogate and see to what extent can we respond to this, how this issue is evolving in different contexts. So even as I just conclude my thoughts for now, I'm just thinking around the advocacy space that where the various actors, as Nakali has listed, we have Equality Now, Girls Not Brides, etc. We tend to work with these issues in silos. Even when there's an obvious interlinking, as you have rightly just demonstrated, given the countries that are given. So I wonder, what informs this somehow siloed approach? Is it one that is informed by that we truly believe that these practices can only be dealt with separately for us to deal with them really conclusively? Or is it an issue also around the space? Can we also interrogate the space? Is it an issue around the interests, the politics of the space, the funding patterns, the funding cycles? What other factors really determine how we as actors working in this space collaborate or do not collaborate? For example, at the Africa regional level, you have the Salima campaign and you have the child marriage campaign. So what informs a merger of the two or putting them separately? And even when they're brought together, what effort are we putting to ensure that we're actually speaking to the very rich data and evidence that you've shared with us today, so that we're actually not shooting ourselves in the feet, or rather falling short of what is expected of us due to other dynamics that we in the space? For us who work in legal advocacy, I think the thing that is very critical for us is that 18
I'm going to interrupt you a little bit to ask you to quickly summarize so we can have time to hear from the panelists.
Sorry, Nankali. So I think it's I've even forgotten what I wanted to say about legal advocacy, but I think I was just saying that for child marriage legal advocacy, it becomes more nuanced, because it's not just 18 as a minimum age of marriage. You also want to push for laws and advocacy that speak to education, to health, to justice, to basically there's so many sectors, and as you say, there's the rural living, there's a level of education, and there's the poverty levels and all that determine. So you want to ensure that all your policies are aligned to respond to that. And lastly, I think the issue around gender transformative approaches, I think, is very critical. Harmful practices are just but the symptom of why we are here. I think it's very critical that we always go back to the base. And I think that's where we can all rally around and ensure that we are working together as a sector. Thank you so much, Claudia and Nankali. I'm happy to respond to any thoughts that may come up after.
Thank you. Thank you so much, Flavia. Lots of food for thought. I think it's been great to hear Claudia talk about the data analysis, and then Flavia, you've grounded it and talked about, programmatically on the ground, what does this mean? What are the issues that we're facing? And thanks for bringing up the AU and the different campaigns, not just at continental level, but even at country, and how we work together with both of these issues. I'm being very mindful of time, so I want to bring in Yvette to also share her thoughts, her reflections on the presentation. Over to you, Yvette.
Thank you very much, Nankali, and thank you to Claudia for an excellent presentation that summarizes a lot in terms of the data that has been collected on the relationship between the two. Flavia has done a fantastic job in terms of capturing a lot of issues, so I won't belabor the points that she's raised, but really just start with a summary that, as we know, both issues have similar causes in terms of their drivers, poverty, which you've articulately put out in the presentation, the norms around virginity and chastity, are seen as more desirable once you've been cut and before you get married. And we know about the negative consequences that young girls and women face after they've been cut and when they get married early, which include maternal and neonatal deaths, birth complications, the effect of stigma and social isolation on the girls themselves, but also on the families that they come from, and increased cases of gender-based violence. So just going into the data that has been presented this morning or afternoon, we are looking at the importance of subnational data and really emphasizing the need to identify ethnic variations. Kenya has been used as an example, and it's also the example that was used in a recently published piece also by Population Council that really explores the fact that in some contexts we have high cases of FGM amongst the Turkana, Somalia, and Kuria, for example, and in some cases, very high cases of child marriage. But I think it's important for us as we look at ethnic variations to also consider cases of Burkina, where it would be good to explore in comparison to Kenya, where an enabling environment is helping reduce the cases of FGM, for example, in a context where people know that child marriage is actually of higher prevalence, but there's much more work being done on ending FGM. So I would employ a study to be conducted that would compare where we have good enabling policies and frameworks on one issue, if that is what is leading to a decrease, and what impact that has on the other issue, for example. If we come to the importance of a multi-sectoral approach, and Flavia has talked about the need to engage other sectors, be it SRHR, the need to enhance girls' education. If you're looking at poverty eradication and the impact that this has on both practices. Recently, I read an article around Somalia and the fact that the cutters themselves are knocking doors, house to house, looking for clients so that they can have some form of income during this very critical time that we are faced with lockdowns during COVID-19. So what is the impact that this has in terms of collaboration and adopting a multi-sectoral approach in the way we look at these two issues? At the onset, Nakali, you mentioned that Girls Not Brides has conducted a literature review in Kenya, where we're also trying to establish if we have enough data and research that shows the relationship between FGM and child marriage, and how that would then affect practitioners and impact on the way that we're able to do this. But also going back to the issue of resources, where we know we have diminishing resources in contexts that have to do with girl-centered programming. How are we as practitioners working together on budget advocacy? So we are looking at the budget in totality insofar as the different sectors that would affect a girl. When we go into legal and policy reforms, we are talking about the importance of looking at laws and policies. And we know criminalization alone is not effective. If we celebrate the gains that have been done in Sudan most recently, but then looking at the impact these laws have in then causing stigma and isolation. So if you're looking at, for example, FGM being criminalized in Kenya, but then girls being jailed for the basis of having undergone the cut, what impact does that have on the society as well? So important to evoke also a multi-sectoral understanding of how we address these two issues. COVID-19 presenting us a good opportunity to also look at the impact of restrictions and the home as a primary site of violence. So it would be good to hear from participants on this call how that is reflecting given the recent that has been announced by UNFPA and others. But most importantly as practitioners is when we go into the communities, we are targeting the same individuals. When it comes to the influencers, when it comes to the traditional and religious leaders, we are working with the same champions against FGM and child marriage. And what does this present in terms of fatigue from the community itself? If we evoke a siloed approach, as has been mentioned by Flavia, where one organization goes in March and another one goes in June, yet we are saying that we need to end this harmful practices, but we are not doing so in a collaborative manner. And if you also look at the resources from a donor perspective, we now have an increase in terms of awareness from the donors to address the two issues in tandem where it matters in terms of the context. But then we're also looking at the possibility of duplication. So for example, when we have one global program on ending FGM in one country and another one on child marriage, are we looking at how this can affect the same government officials, for example, who are mandated to deal with girls' issues? So if FGM is being addressed by the Ministry of Gender, for example, and one is being addressed by the Ministry of Children Affairs, are we looking at a system that we are creating a coordination mechanism in country that would pull in the resources that are limited to be able to work on these two issues in tandem? And then looking at how we can converge our thinking as stakeholders from the global to the subnational level. And the global program to end child marriage, this is an opportunity to see how best that linkage can be created, so that in as much as we know that there are programs being effected at the global level, those are translated to the regional level through the bodies that we now have under the AU Social Affairs Directorate, and then that goes and is mainstreamed in country at a national level through the different ministries that are working on these issues. Then I also want to flag that it's important for us to also look at, you mentioned the wealth quintiles, but really looking at the outliers. For example, we know that in Ethiopia, for example, some of those who are cut are still from the wealthier populations. And I really want to congratulate, for example, the countries such as Ethiopia, where this is being looked at, not in isolation, but looking at a harmful practices approach where it's applicable, for them to be able to see how best that they can work on these issues together. So in summary, I really want to emphasize that both practices are an affront to girls' ability to be able to achieve both their autonomy and their integrity, and they are both causes of violence that need to be addressed, given that we know that these are both practices that are advanced by religious, cultural, and other explanations. It's important for us to also adopt a social norm. Thank you, Claudia, and thanks to Flavia for the introduction.
Thank you so much, Yvette and Flavia. Colleagues, for those who have tuned into this, Yvette and Flavia saw this presentation for the first time right now, and they were able to respond so aptly, so we're really grateful for that. Lots of discussions about, you know, how we work better, how we work more in a more efficient way in terms of bringing the harmful practices agendas together as much as possible, and certainly where it applies. And I hear you both, Yvette and Flavia, around looking at how the two global programs can also work better across these two issues. And I just want to reassure you, before Claudia comes in to answer some of the questions, that certainly for us, you know, we hope that even through presentations like this, we're showing to you our openness of linking these two harmful practices where it makes sense. We saw Claudia's presentation about Niger, where you have very low rates of FGM compared to child marriage. And so in some situations, it might not necessarily make sense to be able to create those linkages. And I think that came out quite clearly in Claudia's presentation. In others, it makes sense. And the one thing I'm also taking away from her is that if we are trying to ensure that we reach everyone, and especially reach those who are most vulnerable, I'm taking a strong message from Claudia's presentation around the particular vulnerability of women and girls who've gone through both harmful practices, the poverty that's affected them, the education, and, you know, kind of there's a cycle there that will ensure that they'll carry on to be excluded from everything. And so there's a particular vulnerability of those who have gone through these two practices, and it's something that we need to watch out for and be more responsive to as we go forward. We only have 10 minutes to the end of the official time for this presentation. I would like to plead to people who are taking part for an additional 10 minutes, so we can have 20 minutes just to have some feedback from Claudia, from the questions. Claudia, please guide me. We've clustered them, but I understand you're also looking at them. Amongst the top questions to you is, you know, when is this information going to be available to be published for people to be able to see? People are looking for your contact. Amongst many other things, there's lots of questions, you know, around ethnicity and how do we define ethnicity, and you really kind of raise that out there. People are looking at asking questions linked to emergency and complex settings. I know this is an area of work that you're also working on, and so maybe you can share that that's some kind of like future work that's coming out. People in Somalia are like, why was Somalia not included? So you need to respond to that. And I can also see that Joyce Zide is raising her hand. So perhaps we start off with Joyce, and then Claudia, you can come in. Joyce, are you there? Are you still logged on? And can you please present your question?
In the chat box.
You've put it in the chat box?
Yes.
Okay.
It was just comments. I found it quite surprising that the two practices are not necessarily linked. And so that was very insightful for me. Thank you.
All right. Thank you. Thank you so much, Joyce. Really grateful that you were able to log on. So Claudia, over to you.
All right. First of all, thank you so much. I mean, I've been reading the comments and the questions you have, and give me a lot of ideas on what else needs to be done. Of course, unfortunately, some of the questions you ask are really research questions. So I hope that through this statistical analysis, this will give insight and enough excitement for researchers to really dig deeper into the understanding of why certain things are not happening as expected or are happening in a different manner. When this is going to go out, we hope to be able to finalize within the next 2 months. So the results are finalized, the analysis is done, it's just production time. So hopefully within 2 months the paper will be out and available. Now, why we didn't include Somalia? Well, we had to, of course, restrict to a number of countries, right? And Somalia is a country where FGM is practically universal. I mean, with the latest survey that was released recently, we see that practically 99% of women are affected by FGM. So doing an analysis of overlap cannot be as powerful because we know that everybody has FGM. So we decided to go for countries where levels are slightly lower so that we can see really, we can unpack this concept of overlap in a more meaningful manner. Now, a lot of you have mentioned the surprise in the fact that the practice do not overlap. Well, they do overlap, but it is not the majority of women. So there is overlap. In some cases, is as high as 30%, 35, 36% of women, of course, in countries of higher prevalence, and it go all the way down, of course, to smaller proportion, 2%, 3%, 7%. So I think it's, as we pointed out repeatedly, we really have to really look at countries by countries, and even within countries, how different this level of overlap is depending on certain ethnic groups. So if your intervention is focusing, for instance, an ethnic group where the overlap is very high, then of course with the intervention will be able to capture really like a significant portion of women who are affected by both, right? But if you target one ethnic group, it will be important to understand for that ethnic group whether most women are experiencing both or experience one or the other. So again, it goes back to the point of context. Now, ethnicity, some of you have asked about the characteristics, whether ethnicity is also linked to socioeconomic status, meaning certain ethnic group being more economically and educationally deprived than others. Of course, this is clear. There are association between ethnicity and wealth, between ethnicity and education. So these are different type of analysis or underlying analysis, but of course there is a significant association between ethnicity and socioeconomic characteristics of the ethnic groups. Let me see, I hope I address most of the questions. The other ones are very much related to programmatic implications, or really like understanding the connection between the two practices. And indeed, we conducted a literature review as well of qualitative study that try to explain how these two practices are connected. And of course, the issue of marriageability came up. the issue of preservation of virginity came up. So we do know that FGM in some context is a precursor for child marriage, meaning once the girl is cut, can be married, is marriageable, and marriage can happen after. So we included acknowledgement of how this practice occur in the literature review component of the paper. I'm going to stop here because I'm mindful of the time, and if there are additional questions that we haven't addressed or that I haven't addressed, we will be happy to follow up with dedicated emails to respond to the questions.
Claudia, before we end, I see Mahnaz Harrison has their hand up. Mahnaz, please come through.
Am I unmuted?
Yes, we can hear you perfectly. You're unmuted.
Okay, thank you very much. The question I had, I wrote it up in the chat, but I think maybe it got overwhelmed. Thank you for excellent presentation, all of you. The question I had is, from where we see it, and we are into a sort of space of FGM being eradicated, that the age of FGM is continuously going down. So the report, Claudia, wonderful work, is focusing, the youngest age is 18, where we are seeing in Mali, the girls are cut upon arrival, upon birth. You look in Egypt, this is from age 0 to age 3. You look in Kenya, has gone down to 9. We work in Korea. So I have a fear that by looking at only the numbers from 18 and over, we might come up with the idea that, oh, the prevalence is going down, where effectively the prevalence is only going down because, or if we see it, the prevalence is going down is only because the age that the girls are getting cut is becoming younger and younger. Could any one of you elaborate on that for me?
Mm-hmm. Yes, I would be happy to do so. I think the patterns on FGM by age, again, change country by country. In some countries, we notice that the age is going down. In other countries, the age is going up. So I think this analysis of FGM by age, we have done so a number of times, and we are updating these as the new surveys become available. The age patterns is different a little bit from one country to the next. What we are looking at, and why we are looking at levels among women 18 and above, is because this is where the risk of FGM is reduced, because by the age you turn 18, by the time you turn 18, either you're cut or you're not, right? So there is no censoring in prevalence. That's why we did so. But it doesn't mean that we are not covering, of course, those who are cut within the age range 0 to 17, right? So the fact that we are focusing on, we do the analysis is exactly because we do not want age to be a factor influencing levels due to censoring. So we take into consideration the age of cutting when doing this analysis, so that we don't exclude women who are not showing up simply because they are too young to be cut. I hope this addressed your concern.
Thank you so much, Claudia. Jamila, we see your hand is up.
Yes, hi, thank you very much, everyone. I think it's a really insightful presentation. I'm the one of the participants from Somalia, and was a bit disappointed why Somalia isn't included. But thank you, Claudia, for the explanation, because we're still struggling. A question to, I think, the panelists or anybody who can respond. The two main factors around education and ethnicity as kind of the drivers, or the conclusion that you have reached the analysis. And while we are really, when the campaigns we are working on currently is focusing on ending child marriages or ending FGM, would we be able to make any progress without addressing those two main key factors, education and ethnicity? And for example, in Somalia, it also includes the most marginalized ethnic groups, for example, who are also poor, uneducated, and they also practice both FGM and child marriage. So just some reflections from the panelists or Claudia, please.
Thank you. So we're trying to wind down now. So let me also take the final question from Adriana Kaplan. Adriana, we see your hand up.
Hello, can you hear
Hi.
me?
Yes, we can hear you. Welcome.
Okay, good morning to all of you. Claudia, thank you very, very much for presenting this in a very clear way, although a little bit dense, but we need to review it. Just linking different things. In the Gambia and Senegal, age, as it was said, has gone down, 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 and sometimes less than 1 year. In Senegal, in Casamance, we have discovered that this rite of initiation with the Jolas, they're doing it in 2 different stages. They cut when they're babies, and they do this ceremony in the bush when they are pre-adolescents before getting married, early marriage. So maybe we can also try to link these rites of passage, the time they're doing it, the time they're doing the cutting, and the time of child marriage, because I'm sure that there is must be a difference between elders with the ages that you're working now, and this decrease of age. I don't know if my English is clear. We need to see what is the influence of this child marriage and the age of cutting that has gone down, because at least in the Gambia, on ethnographic work, what we have found is that many of the reasons that they cut at an earlier stage is because they say that maybe it was not properly done when they are older. So if you cut it younger, this will prevent girls to get married, to get pregnant outside marriage.
Okay.
Also, is more complex, at least from the ethnographic point of view or the anthropological point of view, is very complex. And what you have presented today gives a slide, as you say, food for thoughts. And I'm very thankful for this contribution and all the interventions. Thank you.
All right, thank you very much. Colleagues, you've posted a lot of questions on the chat box, and Adriana's also added an additional one. We've run out of time, so what I'd like to do is just to kindly ask all panel members if they have any final words and final responses to any of the issues that you have raised. So Yvette, do you have any final words or responses to any of the questions that have been raised?
Thanks, Nankali. I just really want to go back to what we've highlighted in terms of looking at how we can adopt a multisectoral approach to addressing both issues. When it comes particularly to education, we do know that there are bodies like the Global Partnership for Education that is now working intensively with groups that are engaging in harmful practices to see how best we can come up with strategies that would advance not only girls' education, but education in a sense that would see us ending some of these harmful practices in as soon as time as possible. And then just to flag that we do recognize that these are issues that are happening in our communities. So it's important for us to also work with the communities themselves to come up with ways within which they can have greater ownership in some of the programs and activities that we are doing, and at the same time also develop monitoring and evaluation tools that the community itself can adopt so that impact therefore is generated in a manner that they themselves will be able to ensure is sustainable. Thank you.
Thank you very much, Yvette. Flavia, over to you. Any responses to any of the issues that have come up, and your final words, please?
I would have loved to respond to Jamila, but I'm not so sure I got it. So maybe we can take that offline. But just to say that listening to the last comment on, I think, the Gambia and the ethnographic work they're doing, I think it just really cements it in my mind that I think it's important to connect these issues from a gendered perspective, from that perspective, that structural issue, like what are the drivers, but it's also very important to now just do a deep dive into every context and to understand what it is that's driving the practices together within that particular context. So it's just a call again for the whole issue around contextualizing and nuancing, but not forgetting that at the end of the day, it's all grounded in one system of patriarchy that we also need to deal with. Yeah.
Brilliant. Thank you. Thank you so much, Flavia. And Claudia, finally, over to you for any responses and final words.
No responses. I see that there are so many other questions I should have addressed. So definitely I will be happy to follow up with responses by email. But again, I think this issue about age is very important and give me, of course, ideas that probably that should be another focus for a further data analysis, is really look at these patterns in terms of age. Because Adriana's point about reducing the age at FGM, does this imply that this might have an effect also on anticipating child marriage to some extent? Since now we are getting younger and younger, does it mean that the girls are ready earlier? And therefore there is a risk there, as opposed to a time where FGM was practiced in adolescence and therefore marriage was following. So definitely we can look at age in more details and see what the statistical analysis can provide to support the statements. Thank you.
Thank you so much, Claudia. And to Colleen, I also want to take the opportunity to recognize the great work that she's doing together with you, Claudia. Thanks to everybody who has logged on to this webinar. The hour went by so fast and we even exceeded, so I apologize for not managing the time very well, but I think there was lots of things that we would just wanted to ensure that there was space to be able to discuss them. We've taken note of all the questions that you have in the chat box, and we'll be responding to them and sending feedback to everyone. Thanks for registering. So we have your email addresses, and so we'll respond back to that. We will also be posting on our social media platforms, so you can be able to pick up on it there. Please do keep engaging with us and tell us which areas it is that you feel that you require more information. On behalf of Claudia and her team, I'm offering that we're here to be able to provide more information for you in order to enhance programming as we go forward. Big take home for me is the issue of contextualization. I think there's a number of issues, you know, we must be conscious of levels. So perhaps at policy level, at continental level, there are things that we can do better by bringing these two harmful practices together. But when we do want to be able to reach elimination, when we do want to be better responsive at country level, and particularly at community level, I think we need to be clear, you know, what the prevalence rates are, what the drivers are, what the pros and cons are for bringing these two issues together, and be more responsive to the different contexts that we work at. As we close, I just want to reaffirm that from our side, we continue to stand behind girls. We see, you know, through Claudia's presentation that they're still being denied their rights, still being denied their chance to be able to make decisions, still being denied to have a voice, and most importantly, still continue to be subjected to harmful practices, something that we as a community continue to look at how we can be able to stop and eliminate before we get to that 2030 point. So thanks to all who have taken part. I see all the thanks in the chat box. We really appreciate it, and we look forward to having another presentation at a different time to share different analysis that has been now. For now, thank you very much. Have a great day, have a great evening, and thanks to all for logging on. Bye for now.
Bye, thank you so much.
Bye, everyone.
Bye.